SurvivorLink was started as and currently is a research project. It's grant funded, and we depend on that funding to initially develop the website and also to develop new features. So we're constantly applying for both public and private funding. The research project was started really to connect healthcare providers and cancer survivors and their parents across the state of Georgia. SurvivorLink isn't just a website. It's a whole team of people that work hard together and are passionate about SurvivorLink's core values: learn, store, and share. Learn about cancer survivorship, store healthcare documents online, and share those documents with survivors' healthcare providers so that those survivors can get the best possible healthcare going forward. We have physicians, epidemiologists, research nurses, psychologists, health systems engineers, and myself, a software engineer, on this team, all making it happen.
The purpose of the Survivor program is to begin to follow survivors once they're 2 years off therapy or after the completion of cancer treatment, to follow them for the early detection of any side effects or late effects they might have from their cancer therapies. When a patient comes to the Survivor program, we provide them a Survivor healthcare plan. A Survivor healthcare plan is the roadmap to survivorship. It has 3 important parts. The first is a medical summary of all their cancer treatment. The second is a personalized late effects risk profile. And then thirdly, once we know their risk profile, we have a surveillance plan. Having the SHIP or Survivor Healthcare Plan is very important for survivors. Once they have that, they can receive their care in a number of places. It's key for anyone who's providing survivor care to have access to the Survivor Healthcare Plan or SHIP. And that is where SurvivorLink comes in. SurvivorLink is a web-based system that's patient-centric. Patients can upload their SHIP and any other important healthcare document to SurvivorLink. Once those documents are on SurvivorLink, the patient then controls who has access to their electronic health records.
My name is Jonathan Reedy. I am a leukemia survivor from here at Children's Healthcare of Atlanta. I was diagnosed when I was 11 years old in December of 2004. When I think back about everything that was going on, it was a hard time, but I think about it like with joy. I know that's weird, but I don't remember the bad times. I know there was bad times, but I think of the fun times of I remember playing GameCube with the nurses and being Mario Kart and watching The Incredibles for the first time while I was in the hospital, and Star Wars Episode 3, that was a big thing, and it amazes me the amount of people that, just cared for me.
I'm Chris Reed. I'm Wyatt Reed's father. We knew Wyatt was a sick little boy at an early age with some low platelet issues. We went to pediatricians. We went to several hospitals to see what could be done about it. He was given some blood products to try to boost his immune system. From there, they found out that he had monosomy 7 along with acute myelodysplasia, I guess, which turns into leukemia. The only cure for that is, a real cure was a bone marrow transplant.
My name is Jessica Stapor. I'm 13 years old. When I found out that I had cancer, it was a little hard, especially for my mom. She always worries about me and everything, and
it was hard, it was shock for us, I never thinking, just my child can have a cancer, and when I hear cancer, I know it's dying from that, but not this time, not her. And so I said we'll be fighting, and do everything. I spending lots of time in hospital with her, and finally the wonderful doctors help us, and they find the match from the list, and then she have the best one from placenta cord. So it was the very, very big day for us. And July 2nd, 2010, my mom came, my husband, when everybody was in the hospital, we was celebrating. They make posters, they put music, and just was so big day for us, because they giving my daughter a new life.
The month of May, May 2005 was the big month. I started the first 2 weeks with radiation pretty much it destroys your immune system, and then you have to rebuild it with the bone marrow transplant. My bone marrow donor was my older brother. Ever since then, my brother calls me Mini-Me. It's funny, it's also little things that we joke about, like my brother loved Reese's peanut butter cups and I never liked them, but now I love them, so it's I don't know if that's genetic now or something. I first heard about SurvivorLink right when they made it, and recently I used the website when I meet my new dermatologist, because my old one moved. If they don't have my Survivor healthcare plan, my SHIP, that's the easiest place for them to get it, is because they update it every year, and I can always it's just an easy download, click, then I can just go hand it out to whoever needs it, to any of my doctors. And it's once you hand them that, then it's okay, they know everything to do with me. And I think that's the best thing about Cancer SurvivorLink.
And so they also told me about SurvivorLink clinic, and we can put our records, and be easier for the other doctors to look at it. So I registered for that.
When you're coming once a year, they do a complete finger test, and it's a long report, and that's put on that website, and you get to immediately go on there and see exactly what they've done, where he's headed, the results, that kind of stuff. There's a lot of websites you can go to that give you information about leukemia, about blood, and it's got a lot of other stuff. He's participated in Camp Sunshine. The Camp Sunshine site is on there. Photographs, pictures, that kind of stuff, activities that they've done, that's on there. That's real good.
Redesign of the site took about 3 months from design to go live. It was a complete overhaul of the UI. We did not make a lot of changes on the back end, mainly because of time and budget constraints, but it is a completely new UI with a completely new set of master pages. This time I used a lot more client-side code and Ajax, and the DevExpress components played a very big role in that, because it's very easy to get the client-side functionality you want using those components. I've used the grids, used all of the primary editors, such as text boxes, labels, memo, buttons, checkboxes, radio buttons, and also I use the callbacks and callback panels quite a bit as well in order to add that client-side functionality. I'm really glad that SurvivorLink can play a role in helping these cancer survivors. It helps enable the communication between the parents, the patients, their doctors, and allows them to have long, healthy life by getting the treatment that they need.
It's been a long road. It's 10 years since I was first diagnosed. It will always be there. I always need to keep track of it, but Cancer SurvivorLink has helped lessen the burden. Whenever
I go to Camp Sunshine, which is the camp for all cancer kids, there was one year that I was in a spiky cast from here to my ankles, and I always kept a positive attitude, and I think that if maybe I wouldn't have had cancer, I might have not been who I am right now, and all I have to say is just life has never been better for me.